This is a presentation from WholeHealthWeb.com on what every mental health practitioner absolutely needs to know about natural health care. And this presentation is for doctors only. The presentation contains information that's intended for doctors who deal in mental health issues. Natural health care, while not a cure for every patient, can produce some gratifying results. Obviously, in the mental health field, you're going to have people who have had horrific experiences in the past that they're dealing with, and other issues that might not be applicable here. What we're trying to do is to enhance what you're doing with nutrition and help you get better results. We'll start by saying that the brain is an organ. It's no different than the heart, liver, or lungs. All organs need proper nutrient intake, proper elimination of waste, proper hormonal balance, and proper blood supply. When the heart's not properly cared for, it doesn't have proper raw materials, you get chest pain. When the brain is not properly cared for, you get depression, anxiety, or confusion. Obviously, nutrition is not the only cause of these problems, but once again, this can enhance your current practice. And first of all, we'd like to say always start with basic diet. Things like sugar, hydrogenated oils, food additives, and refined grain can all affect mental performance. To make this easier on you, we've actually got a free MP3 file that you can download at WholeHealthWeb.com. It will give you patients good dietary advice. And also, many doctors and patients are stunned to find out how well simple dietary improvements can help patients' mental symptoms. For patients taking antidepressant medication and it's working, it's because of the body's biochemistry. And sometimes if you look at that chemistry a little differently, for instance, if antidepressant meds work, why do they work? Okay, to make norepinephrine, persons who are deficient in norepinephrine usually has that lower than a whale's belly kind of depression. They're just at the bottom. They don't want to move. They're not inspired to do anything. And that starts with the amino acid tyrosine to make norepinephrine. It needs cofactors of iron, niacin, folic acid, which gives you DOPA, which is converted to dopamine with the help of B6, which eventually becomes norepinephrine with vitamin C and copper. Now, if anything's interfered with in this pathway, the person will not have enough norepinephrine. And very commonly, B6 is a common deficiency, vitamin C, folic acid, especially folic acid is found in green vegetables. You get someone who doesn't like green vegetables, they might not be making enough norepinephrine. Tyrosine is an amino acid, poor digestion. Vegetarians may be deficient in tyrosine. Serotonin, on the other hand, people who are serotonin deficient tend to be agitated. They don't sleep well. Serotonin starts with the amino acid tryptophan. Okay, and you need niacin, folic acid, and iron to get the 5-hydroxytryptophan, which is commonly used. You said people buy this in health food stores. And then with B6 eventually becomes serotonin. So support here, and this is one of the reasons why diet helps. If you're eating a nutrient deficient diet, it's very common to be deficient in the amino acids, in the folic acid, in the niacin, in the vitamin C, and so on. So that's why very often if you change somebody's diet, you can improve their mood. And along with diet comes exercise. There's a number of studies that show that exercise actually outperformed antidepressant drugs. Okay, it's one of the easiest way to increase serotonin. And very commonly you see someone who's depressed and then they don't want to do anything like get moving. If you get them moving, get them breathing, very often they'll feel better, especially if you've done the dietary changes. One of the first areas you want to look at with your patients, and it will pay great dividends, is insulin insensitivity. This is very common in the United States, and you can cause mood swings and depression. These are people that crave sugar and carbohydrates and actually are becoming insensitive to their own insulin. In general, people with insulin sensitivity will have a BMI greater than 30. They'll carry weight around their abdominal area. They crave sugar and starch. These are also people that like to nap after they've eaten. Symptoms also include fatigue, weight gain, brain fog, carbohydrate craving, periods of hypoglycemia after a high carbohydrate meal. Once again, they eat and then they crash. Approximately 50% of your patients with high blood pressure are insulin insensitive, and approximately 30% of Americans are insulin insensitive, and 20% of them 25% of them have Syndrome X. Syndrome X is a situation where the insulin sensitivity gets so bad that the cholesterol starts to rise, and then they tend to have high triglycerides and high low density or the bad cholesterol. The Journal of the American Medical Association states that if a patient has 3 or more of the following symptoms: waist measurement greater than 40 in men or 35 in women, triglycerides greater than 150, HDL lower than 40, blood pressure greater than 135 over 85, or fasting glucose of 110 milligrams per deciliter, Syndrome X is present. Okay, this is an extreme form. This is insulin sensitivity taken to the next level. And these people will tend to be depressed. The treatment would include a low glycemic diet, a supplement that includes B vitamins, magnesium, and chromium. There's a number of companies that make this. Biotics Research has an excellent product called GlucoBalance. You give them 3 to 6 of those a day. Will bring down triglycerides, will help get insulin sensitivity under control. Lipoic acid at 600 milligrams a day has been shown to lower triglycerides. Omega-3 fatty acids or fish oil. The interesting thing about that, and Biotics makes a lemon-flavored fish oil that you can take in tablespoon amounts. One of the things that will do also is help bring food cravings under control. Another thing to look at in patients who are depressed is for hypothyroidism. And the common test for thyroid function is TSH, or thyroid stimulating hormone. It's very inadequate according to the British Medical Journal. And it isn't even a thyroid hormone, it's a pituitary hormone. Symptoms actually have more importance in diagnosing hypothyroidism than the labs do. And you want to look at other lab values, and you piece all this information together, and then you can nutritionally support the thyroid and get very gratifying results. Normal TSH range is from 0.45 to 4.5, but many people in natural health care believe that if the symptoms of hypothyroidism are present, a TSH as low as 2 might be significant, 3 for sure. And hypothyroid symptoms include feeling cold when others do not. This is the person who's sitting on the porch in the summertime with a sweater on. They have fatigue or lack of motivation. The fatigue in hypothyroidism is like a non-motivated. They can get through work, they can do whatever they have to do, but if they don't have anything to do, they tend to just lay there. Poor memory, poor concentration, loss of interest in sex, dry, itchy, or scaly skin. This is also a cause of high cholesterol. They'll tend to get muscle cramps, they'll tend to be constipated. Women will tend to get cysts and fibroids. Big one is crying for no reason. They get very emotional. I watch the AT&T commercial and tear up. And puffiness under the eyes and ankle swelling. Depression, this is a big deal. A lot of people on antidepressants actually need their thyroids checked. They'll catch cold a lot and maybe have an inability to lose weight. A person won't necessarily have all of these symptoms, but will have several of them if they're hypothyroid. Now, Dr. Broda Barnes was a big proponent of using basal body temperature to check thyroid, and the people with hypothyroidism do tend to have low temperatures. Unfortunately, there's other things that cause low temperatures, so it's not a diagnostic. It's not an absolute diagnostic tool, but if you've got symptoms and your labs are leaning in a certain direction and you've got a low temperature, definitely could be hypothyroidism. And the way you take a basal body temperature, you take it in the armpit because there's too much variability in the mouth. You have them shake a mercury thermometer the night before, and they take it first thing in the morning before they move or do anything. The temperature should be ideally between 97.8 and 98.2 degrees Fahrenheit. If it runs much lower, and you want to do this for about a month, but if it runs much lower than that, hypothyroidism is a possibility. And if you're going to do labs, you should look at T3 and T4 as well. If T4 is less than the middle of the lab range in presence of these symptoms, okay, without symptoms, the labs, if it's a normal lab, it doesn't mean as much. But if you have a low T4, there's a very good chance that the patient needs iodine and tyrosine, which is basically the raw materials for thyroid hormone. It is actually the more active form of thyroid hormone, and if it's below the middle of the reference range and T4 is above the middle of the reference range, it's a conversion problem because the body actually has to convert T4 to T3 to function. And a lot of times people that are taking Synthroid is T4, they'll actually still have a lot of their thyroid symptoms because they're not effectively converting. And this can be caused from too much stress, other hormonal issues like estrogen, lack of nutrients. And there's another test called reverse T3 that will, you might have normal values, but you have a high reverse T3, and that's not an active form of the hormone. It'll make the numbers look good, but the person is still having symptoms. The treatment for this, it's a little bit involved, and rather than spend a lot of time on this particular video on thyroid, we've actually prepared a thyroid report for you. You can download it for free at wholehealthdocs.com. You can just go there. There's actually a lot of good stuff there for you. There's practice marketing material and other things. Vitamin B12 is another common deficiency. You see this in the elderly and in vegetarians and a lot of people with poor digestion. It can lead to depression, confusion. There's some people that if it gets bad enough, it can even mimic Alzheimer's disease. Okay. Unfortunately, the serum B12 test is not very reliable. You're much better off testing for homocysteine or methylmalonic acid if you want to find a B12 deficiency. And there's research that supports this. One good little trick is to look at a CBC and the mean cell volume. If it gets much above 90, you can suspect a B12 and or folic acid deficiency. It's cheaper than running the tests, and you can give the patient the supplement and find out if it works. And a lot of people are under the impression you have to give B12 shots to get a result, but that isn't true. You can take a very high oral dose, and we're talking about 6-8 milligrams per day, usually accompanied with folic acid. You like to take those two supplements together. And Biotics makes a product called B2000 lozenges, which has 2 milligrams of B12. It's got a little bit of B6 in it and some folic acid. And you can take anywhere from 3 to 6 of those a day and offset a B12 deficiency. And like I say, the patient will really, really improve. And sometimes you don't need these extra labs. But if you see a high mean cell volume, suspect B12, especially in a patient that's depressed or confused, and especially an elderly patient. So the most common depression, source of depression in the elderly. Since we're on B vitamins, we might as well mention thiamine here. People who eat highly refined diets, are your insulin sensitive persons eating a lot of sugar and starch, are going to be deficient in B vitamins. And B vitamins are very necessary for brain function. And thiamine in particular, there's a couple of clues that'll tell you thiamine deficiency. The patient will have low blood pressure, and also they'll have a tendency to fall asleep quickly at night but wake up after only a few hours of sleep. And a lot of your insomniacs, we have a product, Biotics Research has a product called Bio3BG. Basically, it's got 3 times as much thiamine as a regular B complex. And they'll actually give the patient one of those an hour. They're very small pills, very low dose. And you do it for 2 days, and then you go to like 2-3 times a day after that. And this will fix this problem. And a lot of people that are depressed and have a lot of other problems will greatly improve with this. And especially if you see low blood pressure. A person with low blood pressure, you always worry about high blood pressure for a stroke, but low blood pressure, a person doesn't feel very good. They don't have good energy. A lot of times they're depressed. And the amino acid involved with anxiety is GABA, gamma-aminobutyric acid, which comes from alpha-ketogluteric acid, which is a product from the Krebs cycle. And alpha-ketogluteric acid has been given as a supplement for anxiety. But if you look at the cofactors that make the Krebs cycle work, you'll see a lot of B vitamins and a lot of magnesium. So a lot of times this is a deficiency in someone who's anxious. And once again, especially with a refined diet. Another thing that can mess up Krebs cycle activity is heavy metals. It'll suppress GABA production. And heavy metals can cause fatigue, depression, anxiety, confusion, chronic pain syndrome. So this is worth screening for. Even just a simple hair test. There's chelation challenges. There's ways of testing for heavy metals. Blood generally is not a great way to test for heavy metal because blood will show you a recent exposure. Now, lab work can help you with the more difficult cases. Start with changing diet, basic supplementation. A lot of patients get help. Lab tests can help you dig a little deeper into the causes of mental issues. The first thing that you need to understand is that the bowel is an ecosystem. Antibiotics disrupt it. There's several pounds of bacteria in the large intestine. They belong there. Okay, you take antibiotics, eat too refined a diet, you disrupt that ecosystem. Bacteria are supposed to keep pathogens in check. They produce vitamins, a lot of your B vitamins, even B12. They nourish the intestinal lining and they break down toxins. Now, if you have problems where you've got yeast or bad bacteria, they're producing toxins. A lot of those are neurotoxins. Autism has been linked to problems with yeast. They damage the intestinal lining. They burden the immune system and they create allergies. Okay, so this might be a cause of autism. It could be a cause of just simple depression. And you need to test for this. You can do bowel testing, stool testing. You can also do tests for bacterial metabolites, organic acids in the urine. So stool analysis or organic acid in the urine test will give you an idea if this is part of your patient's problems. And a lot of times people with these bowel issues, they have a lot of other problems. They might have a lot of allergies. Smoke and perfume will bother them. Usually it's pretty debilitated health that you're looking at when someone has a lot of bowel problems, and it's really worth testing. Another thing worth mentioning is hidden food sensitivities. Hidden food sensitivities can cause depression, anxiety, a lot of other problems too, sinus problems, headaches, many chronic problems. And you can do this with lab tests. You can do it pulse testing. You can do it avoidance. The two common ones are wheat and dairy. One good way to do that is take them off of all gluten and off of all dairy for a week, and then have them reintroduce gluten or dairy. And what will happen is they feel really good when the food's gone, and then when they reintroduce it, their symptoms get worse again. Amino acids are the building blocks of protein and also the precursors to neurotransmitters. There's 8 essential amino acids, which can be converted to other amino acids, but you can get a deficiency if they're lacking in the diet. If the pathways, these conversion pathways, are blocked by nutrient deficiency, heavy metals, toxins, or digestive issues. And an amino acid test can be very valuable for finding mental symptoms. Worth mentioning testosterone here. Low testosterone can cause fatigue, depression, lack of motivation, and loss of sex drive. A guy who's low in testosterone say, gee, I used to like to go work on my car. I used to like to work around the yard. I used to like to do this or that, and I just don't feel like doing it. Nothing excites me anymore. They just kind of get kind of bland. Biotics makes a very good product. We're not crazy about giving testosterone, the actual drug, but they have an herbal product called B Vital, which has been clinically shown to increase testosterone levels. And talk a little bit about the adrenal gland. This is something only alternative practitioners seem to look at. The adrenal glands, medicine looks at them as they're either working or they're not. They can see borderline hypothyroid, but for some reason they don't look at the adrenal this way. Hans Selye described the progression of stress on the adrenal glands as the general adaptation syndrome. And the first stage is the alarm reaction. This is when someone with healthy adrenal glands can perform amazingly well. The caveman sees the saber-toothed tiger and runs like crazy, run faster than he ever could before, or fight. If the stress continues, the body moves into what's known as the resistance stage, during which the adrenal glands become enlarged, and this is an individual who's responding to the stress and handling it. A lot of times they feel good. They don't see that they have a health problem. A rat kept in a cold room adapts and begins to handle the cold. A rat who has no previous stress will not tolerate the cold as well. Okay, a person in the resistance stage will feel keyed up, may have cold, clammy hands, a rapid pulse, reduced appetite, but hasn't begun to feel any of the serious symptoms which happen. The next stage is exhaustion stage. This is when the adrenal glands begin to fail to meet the demands placed upon them. The individual begins to have a variety of symptoms. They have fatigue, digestive problems, obesity, depression, dizziness, fainting, allergies, and a lot of other health problems. This is somewhere, if you're not used to dealing with adrenal problems, I know Biotics research has many nutrient protocols for the adrenal gland, and one of the reasons we're recommending Biotics in particular is their sales staff are more like nutritionists. They will actually help you to diagnose these, and it's very helpful to fix the adrenal glands. So if you have a patient with mental issues, what kind of protocols can you do? Well, you can start simple. Use nutrition, basic diet, what we call a caveman diet. If it wasn't available 10,000 years ago, it isn't good for you. Diet high in fruits and vegetables. Brightly colored produce is full of antioxidants and vitamin C. Antioxidants have been shown to prevent dementia and actually protect brain cells from environmental toxins. Basic exercise, one of the strongest antidepressants around. It's just simple, light exercise. Do what we call change the patient's oil. You get them off the hydrogenated oil, the fried foods and things like that, and you give them good omega-3 fatty acids, or Biotics has a balanced product called Optimal EFAs, which has some omega-3, omega-6, and omega-9s, and a good multiple vitamin. That's a great start. If you add that to what you're already doing, your results are going to improve. You can get the diet at Whole Health Web and just give the patient the recording, and you'll be very gratified at the results. The next step is to look at insulin. Insulin sensitivity is very, very common in the United States. And one thing you can do is give them put them temporarily on a low carbohydrate diet. If you want to know if insulin's a problem, give them about 40 grams of carbohydrate a day, a couple of small potatoes, a cup and a half of rice. No fruit or sugar of any kind. If in a week the patient feels a lot better, then you know that carbs and insulin are an issue, and then you can gradually increase that. Okay, we'll have an extra potato, go another 20 grams, 40 grams. They'll reach a point where they start feeling the way they used to, and then you back off of that. And that's a good diet for them then. And little by little, if you do the nutrient supplementation, like with Glucobalance and fish oil and so on, they can tolerate more carbohydrate. And then to treat them, you put them on a low glycemic diet, or the follow-up for the carb challenge, light exercise. Give them Glucobalance from Biotics Research, fish oil, and lipoic acid. And check the thyroid. We have the complete report for you at wholehealthdocs.com. For your difficult patients, you want to do stool analysis, amino acid testing, organic acid testing, blood chemistry. Basic blood chemistry can give you a lot of information, and allergy testing. And this has been a presentation of wholehealthweb.com. We did go ahead and mention a particular vitamin company, mainly because we feel that if you're new to natural health care, Biotics Research in particular will offer you very good support without trying to just sell you pills for the sake of selling you pills. They're very ethical, very knowledgeable people. If you have more questions, you want to learn more, please go to wholehealthweb.com and check out the huge volume of research we have there.